How can you tell if you might have cervical cancer? If you notice unusual bleeding between your periods, after sex, or after menopause, it's important to see your doctor right away. You might also have unusual vaginal discharge or pelvic pain, but sometimes cervical cancer doesn't show any symptoms at all, especially in the early stages. That's why regular checkups and screenings are so important. They can catch the signs of cancer before you even feel anything. How common is cervical cancer? Cervical cancer is the second most common cancer for women in India, after breast cancer. Millions of women in India are at risk. There are around 96,922 new cases every year, which means about 265 women are diagnosed with it every day. While things are improving in cities, women in rural areas are still at high risk due to less awareness and poor living conditions. If caught early, 90% of women under 40 can survive. What can I do to prevent cervical cancer? To help prevent cervical cancer, it's important to live a healthy lifestyle. Don't smoke, limit alcohol, exercise regularly, and eat well. But most importantly, get regular cervical cancer screenings. Even though screenings are available in India, only a small number of women actually get tested. Cervical cancer is almost completely preventable if you get screened regularly. The World Health Organization recommends women get screened 3 times in their life, starting at age 30. What causes cervical cancer? Most cervical cancers are caused by a virus called HPV, which is passed on through sexual contact. The good news is that we can now easily test for this virus, and it's less uncomfortable than the traditional smear test. There's also a vaccine available that protects against the most dangerous types of HPV, and it's given to young girls in school. What is HPV? Well, HPV stands for human papillomavirus. It's a very common virus that spreads through sexual contact. Almost all cervical cancers, 99%, are linked to high-risk types of HPV. Most people don't even know they have it because it usually doesn't cause symptoms and often goes away on its own. But if it sticks around, it can lead to cervical cancer in women. Anyone who is sexually active can get HPV, and it's not something to be ashamed of. Even using condoms doesn't always prevent it. Who is most at risk of cervical cancer? Cervical cancer tends to show up in women in their mid-30s and again in their late 60s. The risk is higher if you smoke, have a weak immune system, or use birth control pills for a long time. Having multiple sexual partners or starting sexual activity at a young age also increases the risk. But remember, even if you have risk factors, it doesn't mean you will definitely get cervical cancer. It varies from person to person. How is cervical cancer treated? Treatment for cervical cancer depends on how early it's found. If caught early, doctors can remove the abnormal cells with simple surgery or other methods like lasers. If the cancer is more advanced, treatment may involve radiation, chemotherapy, or more extensive surgery. Some surgeries remove the cervix and surrounding areas, while others may involve removing the uterus and sometimes even the ovaries and other nearby organs. Who should get cervical screening in India? In India, women aged 30 to 65 should get cervical screenings, no matter if they are married or not. If you are sexually active, it's important to get screened, even if you've had the HPV vaccine. How often you need to be screened depends on your health history and risk factors. It's best to talk to your doctor to figure out the right screening plan for you. What are the different options for cervical cancer screening? There are a few different ways to screen for cervical cancer in India. 1. HPV testing. This test checks for the virus that can cause cervical cancer. 2. HPV self-testing kits. In some areas, women can test themselves at home using special kits. 3. Visual inspection. Doctors can apply a solution to your cervix and check for any abnormal areas. 4. Mobile health apps. Some apps help remind you about screenings and provide information on how to get tested. 5. Liquid-based cytology. This is similar to a regular pap smear but may give more accurate results. Are cervical screening results reliable? Cervical screenings are quite reliable, with accuracy ranging from 80 to 90%. This means they can prevent 60 to 80% of cervical cancers, helping save the lives of 7 out of 10 women who might otherwise develop the disease.